All right, welcome to the live call, and I'm going to be sending this out to quite a lot of people, as I was just telling, the patients that were you guys that are on my on the live call here. So I'm going to try my best to get through this here in the next 45 minutes to an hour, but I'm honestly not sure how long it's going to take. And so if you're watching this recording, if I'm sending this out to you because you requested it on social media, um, I'm just going to start. Let's see here. I'm going to start right in to this polarizing topic, right, to say the least. So, my one request of you guys today, if you're watching this and you get something from this, is just to send it to everyone you know, right? Anybody who needs to hear this. You can post it on your socials. I don't care if you share the link. You can send it privately. We need to get everyone to understand the complexities around this topic. And honestly, trying my best today to take the bias out of it, because every human being has biases, right? So I'm going to do the best I can to present to you guys truth, science, evidence, and what it's actually showing, because so much of it is you just get little snippets of things here and there when you're watching, news or if you're scouring social media. So specifically with autism, and you're going to hear me say, and you're going to read on the PowerPoint NDDs. So NDD just stands for neurodevelopmental disorders. So really, autism is included in that. So NDDs, I think, is the better way to address this because this isn't just about autism. It's about the health of our kids. It's the chronic health issues that are going on in our country. And I understand it's a polarizing topic. It seems to me to have become a very political issue as well. Whether I agree with that or not doesn't matter. And I don't care really what side of the fence you guys are all on. Those of you live, those of you who are going to watch this, I just want you to try to enter into this topic today as unbiasedly as you can. And just look at what I'm going to present, and then you can make your own decisions, right? So I'm going to do my best to stick to the science, the evidence of what's real and what's truth out there. So I'm not here to try to convince anybody of anything, but rather present, like I said, the science and the truth of things that may not be well known. And I'm sure if you guys are on social media, you're going to probably know about some of these topics, but I'm going to present, especially in the beginning here, a topic and a point that is not getting a lot of attention. That is a crucial topic in this whole debate. Okay, so many people are getting defensive about this topic. I'm not judging people. I mean, there's a reason everybody has a story, right? Whether your kids are suffering or, some people are even to the point where they're saying, well, my kid's not suffering from a neurodevelopmental disorder. That's fine. I'm not judging that at all. Like, what I care about is the health of our children, the health of their children, and their children's children. And I guess the point that I want to make today is neurodevelopmental disorders such as autism, but also chronic things going on, chronic illnesses, autoimmune conditions, asthma, ADHD, other mental health issues. So many of them are preventable. And if they are, why would we not want to figure that out? Right. So it's become so polarizing and it kind of bothers me to the core. But just as it would be with any other, condition or health issue, cancer or other autoimmune issues, like we want to know what's underlying that, right? So we don't love these people any less. We don't think they're a problem, or at least I don't. And we just want them, I just want them to thrive in life to their full capacity and capability. And that's what this is really all about. So again, I said this before. Today I'm going to present evidence from both sides of the picture and some science behind Tylenol. We're going to hit a little bit on vaccines at the end, but a few other complicating factors that most people are not considering. And I believe that if someone thinks and is under the theology or preconceived notions that X equals Y, I think you're missing the point. You're missing the story completely. There's not very often, in my opinion, where X equals Y or one thing always causes another thing to happen. I think people are sadly mistaking if that's what they're taking from this whole argument. There are so many stories out there. I'm sure all of you guys know people just like I have, but in my profession, what I've done over the years is I've talked to, I mean, gosh, hundreds of families, hundreds of people, hundreds of parents that, their child, again, maybe struggling with XYZ, doesn't matter. And all the stories are different, right? So it's not just Tylenol, it's not just vaccinations, it's not just XYZ. Sometimes we just need to take a step back, and that's what I'm going to encourage you to do today. Take a step back and help all of us, and I'm going to try to help all of us understand kind of the bigger picture. There are so many things at play here, and science and research is great, but yet it's also unable to always fully investigate all of these factors put together. So sometimes we just have to use some logic in what we do know and some of the science we do know, and that's what I'm going to kind of present to you today. Okay, so without further ado, let me pull my slideshow, share my screen. So why doesn't somebody at least give me a thumbs up once you can see that? Looks like Kristen, you're the only one on camera. Can you see my screen yet?
No.
Can anybody else chime in? Because it says it's sharing. Diane, you can see it, Diane? Kristen, you still can't see it?
Uh-uh.
Well, that's interesting.
Oh,
Is it good? Okay, there was a delay. Okay, perfect. Good to go. All right, guys. I said open discussion. At first, when I started creating this, I just had the thought that we would just talk about this kind of stuff. This isn't going to be an open discussion because I got too much to say. So maybe next week we'll have the open discussion if people have a lot of Q&A questions that I can answer. But we're gonna get right to it here. So there's a lot of topics that need to be talked about, that could be talked about, but here are some of the important ones that I'm going to try to cover today. So, acetaminophen use in pregnancy and in childhood. So, I don't think it needs to be strictly just pregnancy. I think giving young children Tylenol is something that needs to be talked about as well. Number two, vaccination schedules and the research behind some of that. Number three, this is where we start to get into some things maybe you don't know about or haven't seen, but folic acid versus folate. What's the difference there? Why does it matter? And then you have this thing called leucovorin, I think is how leucovorin, however you say that, which is folinic acid, which is a form of folate. Okay, and you're going to probably start reading about this because that's a recommendation that's been thrown out there as far as treating or helping any of these neurodegenerative disorders, these NDDs. Okay. And then, oops, I'm hitting the wrong button. Genetics. Okay. Genetics, and specifically something most of you guys on live will know because I've talked about it, is MTHFR. MTHFR. It's so common in our society. I myself have an MTHFR gene mutation. Many of you guys do, many of the patients I work with do. It's very, very common. And this is a huge talking point that needs to be addressed. I'm going to spend quite a bit of time on that number five, the MTHFR and genetics here today. Something we call the perfect storm, right? What is the perfect storm? Has anybody ever seen that movie, The Perfect Storm? I mean, it's just like all of these variables with the atmosphere and all these things create this perfect storm in the ocean. And that's what can happen inside of our bodies, physiologically, biochemically, biomechanically, all the things. So here are some things to think about as we kind of start processing all this information. So many people believe and state that things like autism and other NDDs are purely genetic. Is that true or is that not true? Okay. Many people believe and state that the rise in cases is just because diagnostics have improved. I'm sure we've all heard that. Is that true or not true? And I'm not going to necessarily answer all of these today, but I think as you start looking at this information, you're going to start understanding the answers for yourself. Some people believe that NDDs are caused by Tylenol, acetaminophen specifically. Some believe NDDs are caused by vaccines. Is that true? Is that not true? Neither of these above statements, or none of these four statements, I should say, addresses the bigger picture, is my opinion. None of these address the bigger picture, and that's what we're going to look at. And there is no blood test, there is no brain scan or genetic marker that can diagnose specifically autism, other spectrum disorders, right? So autism and other things in this vast array of things we're talking about are diagnosed on observation of behaviors, developmental patterns, communication and or lack thereof, social interactions, and repetitive actions, things like stimming, if you've ever heard of that. So this is how a psychologist, a psychiatrist, or medical person would diagnose something like autism. Okay. So what then is happening when a child is hitting? So this is a question. It's just a question. If you have a young child that's hitting all of the milestones, okay, is communicating, has eye, contact, has good behaviors, the developmental patterns are happening, and then all of a sudden they lose all of that. They start losing their speech, they start losing the eye contact, they start losing communication. Like, what happened? Does the science really know all of the answers to this? Okay, so questions that you really have to process through. Or maybe, and again, my humble opinion, we need to investigate these things on a deeper, more root cause level than just taking this multifactorial approach, like, or trying to figure out X equals Y. When I personally, again, this would be my bias, is I don't believe that's true. This is the only logical thing to do in my opinion. And piecing together the science and the data would suggest this to be the underlying issues of most of the chronic diseases in our country. Okay, so here's just a graphic. Maybe you've seen this, maybe you haven't, but this is a graphic based on autism again, because that's such the highly debated topic globally. And this is specifically basically one piece of evidence that would make you think twice about genetics, is kind of the point of me showing this. Again, I we'll talk a little bit about genetics here in a while and why I do think they're part of the equation. But when you have North America having, the sky high rates, a couple countries in Europe, not very many, okay, is it a genetic issue alone? Come to your own conclusion with that. Okay? But that's kind of the evidence there. But let's start with what research has shown over and over again that many people aren't talking about or taking into consideration. Okay. Here is the big deal, something called glutathione. I know many of you that have worked with me for any sort of time, I talk about glutathione a lot. Okay. So Tylenol, specifically acetaminophen, can and does factually, based on the evidence, deplete or interfere with glutathione production in the body. Okay, so it depletes or interferes with glutathione production. What is glutathione? Glutathione is a crucial, what some people would say, most researchers would say, the most powerful an important antioxidant that we have in our bodies. Antioxidants help neutralize toxins. It's one of their main jobs. They protect our cells from damage, even DNA damage, and maintain healthy brain and immune system function. Okay, so that's a crucial thing to know. Glutathione, the most powerful antioxidant in our body that our bodies produce, that's going to help us detoxify and keep our brain, our nervous system, and our immune system healthy and functioning optimally. That is crucial. This is one of the reasons why I test so many people for glutathione levels. Are you producing it or are you not? If you're not, I don't care what you have going on in your health, you need glutathione. And so, again, we either need to figure out why the production has stopped, and we can supplement with that too. Glutathione is a supplement you can take. So for a developing baby in utero or just after birth, number one, we know again factually, the nervous system and the immune systems are still immature. They are not fully developed. The brain is going to be going through a lot of development. The immune system is still developing, right? So facts, we know this to be true. So the systems at these stages of life, so again, babies in utero even, that are producing glutathione are still immature as well. Okay. So the systems that are producing glutathione are immature. Glutathione is produced a lot in the liver. It's produced in the brain. Okay. So just so you know. So this is going to make these little ones more vulnerable to anything that stresses or lowers glutathione levels. Okay, so take that in for a second. Okay, so they're not able to, number one, produce enough of this, or maybe as much of this. Okay, and then if we're doing anything that's going to inhibit the production of glutathione, that's an issue. Okay, just logically. So when the liver processes acetaminophen, so you take a medication, every medication you take, doesn't matter what it is, it has to be processed by your body. And they're all going to go into the blood, and then they're going to go through the liver, through the kidneys, just all the systems, right? So as acetaminophen goes through the liver process, most of it goes through a safe detox route via two pathways called sulfation or glucuronidation. Who cares? You don't need to know that. But if someone's going to watch this, that's a science nerd like me. Those are two processes that it goes to be detoxed. So it will not affect you or harm you. But, so BUT, big letters, a portion is metabolized by liver enzymes into a more harmful byproduct called NAPQI. Okay, so you take Tylenol, acetaminophen, it goes through the liver. A lot of it is processed and detoxified, and you eliminate it out your body. But is some that is metabolized into this NAPQI, and it's actually a compound we know is more harmful. It's toxic. Okay, so that's the fact. That's what we know. So under normal conditions, glutathione then comes in and neutralizes this NAPQI, this toxic byproduct, so it does not cause damage in majority of cases. So you have a high functioning liver, right, that makes glutathione. You're going to neutralize all these toxicities and it doesn't cause damage. Now, number one, I'm going to throw in here, aside from this topic we're talking about today, and everybody that's worked with me knows this, that I don't run across, I mean, literally, I don't even know if I've ever had a patient, and including myself, that has a fully optimally functioning liver because it's inundated with toxicity through our entire lives. Food, water, all the chemicals we're exposed to, the air we're breathing, it's just inundated. It's overwhelmed. So most of us have a sluggish liver, is kind of what I call it. It's trying its hardest, but it may not be doing the job. So this is why detoxification and other things are really important. Okay. But for these little ones, we know this it can become a huge issue. Okay. So thus, if glutathione is low, it's been depleted, etc., these toxic byproducts can and do accumulate, and they're causing oxidative stress. Okay, oxidative stress is the inflammation of your cells. It's DNA damaging, it's neuron damaging. So the liver and the brain are being damaged. Okay, so we know this is happening. Okay, these toxic byproducts are going to damage the liver, they can damage the brain. This is one of the reasons that if, one of the warnings about acetaminophen and Tylenol and even ibuprofen and all this stuff is it can cause acute liver toxicity. Okay, that's something very real that in too much doses or too often you can really damage your liver and your brain. We know this. Okay, so that's one point. So just remember this glutathione thing. Now let's move on to genetics. Okay, some genetic differences that do matter. So when I showed that map a little earlier, saying the evidence to me would be like, okay, genetics are not the whole story. But again, my bias, I said I was going to keep bias out of this, but my conclusion, genetics do matter. They do. And I think the evidence will show that. It just may not be the whole story. X equals Y. Okay. So for example, MTHFR. That is like I said earlier, a very common mutation. There's different types of mutations with it. I'm not going to go into all the details, but the MTHFR mutation reduces the efficiency of folate metabolism. Folate is vitamin B9, which is needed to supply methyl groups, which are needed for glutathione production. So you can be a biochemist and you'll understand this. Like, what's a methyl group and like what's folate? Doesn't you don't get too caught up here. Basically, you need vitamin B9, you need folate, okay, for healthy brain and nervous system function. And you also need vitamin B12 and you need vitamin B6, you need others. But specifically, folate is so important and crucial when it comes to neurocognitive, like the nervous system development, brain development. Okay, so that's the take home. This is why folic acid, folate, whatever, we'll talk about that in a minute, is prescribed during pregnancy and then after because it's so crucial for that developing baby. Okay, and it's also important for the mom. Folate, everyone needs folate. Everyone needs all the B vitamins. Okay. Energy production, nervous system health, all the things, brain health. Okay. So, but the take home, folate metabolism is needed to supply the methyl groups, which are needed for glutathione. So, for that powerful antioxidant. So, all of these things are necessary to have optimal function with this stuff. So, glutathione S transferases, GSTs for short, is another genetic issue, kind of like MTHFR, that is also needed to attach that glutathione, that antioxidant, to the toxin so they can be eliminated. So you have a few different things that are needed genetically to happen for you to be able to do all these processes to detoxify from things. Toxins are all over. I mean, we're talking about acetaminophen, but I mean toxins in general. Okay. So if you have variants in that reduce the GST or the MTHFR activity, and here's where I think I said this earlier, I do. I found out just like 5 years ago, I don't know, maybe not even that long ago, when I started to really dive into my own issues in functional medicine, um, I didn't have a clue that I had this MTHFR genetic mutation. Okay. Now, that's a huge deal to know about because it really messes up some of the detox pathways and it also messes up your vitamin B, your B vitamins, and if you're able to use them like they need to be like they need to be used. Okay. So we need to know if you have these mutations. Okay. When it comes to this topic. Okay. These genetic issues may increase the amount of that toxic NAPQI, like I said earlier, and made per dose of Tylenol. So if you just think about dosages, if someone's taking Tylenol every day because they have headaches, they have pain, they have whatever they're taking it for, this could be a major issue. If they do not know they have MTHFR or GST mutations, okay, they unknowingly are affecting this whole process in a negative way, affecting not only their own health, but potentially affecting, and they are affecting the health of the baby. Okay, so I hope everyone's following there. Any questions with that? I hope I wasn't confusing. Any questions? Okay. Okay, so essentially, again, this is also kind of goes to the argument. I could take a tangent here about like, well, how do we know, how much Tylenol? How do we know? I mean, if I take it once versus like every day, does that matter? Yeah, I believe it matters. And I don't know if there's been very many studies that look at that because when you do research, there you have to have ethical guidelines. So they can't take a group of women and say, okay, you have to take Tylenol every day while you're pregnant. They can't do that. That's unethical. So that's what makes some of this really difficult as far as like, X equals Y. Okay, the third thing is folate versus folic acid. I hope you guys know the difference, and there's a huge difference. There's a huge difference. So if you've never heard this before, pay attention, perk your ears up. Folate versus folic acid. Folic acid is synthetic. Okay, it's man-made. Okay, this is often still, it still is prescribed to women by their OB, by pediatrician, whoever they're seeing, their medical doctors. Okay, and it's also being given to kids. Okay, when you're like, oh man, they need more vitamin B9, like folic acid. Okay, so just remember, it's synthetic. Folic acid is also the form that's in most fortified foods and products that are on the market. So we see, folic acid, fortified, blah, 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 blah. Folic acid being synthetic, okay, because it is synthetic, it needs to be converted in the body via enzymes like, let's go back to genetics now, the MTHFR genes. They have to be converted into their active and usable forms with these genes. Okay, so if you take folic acid and you have MTHFR or other gene mutations, this may not be happening. Okay, the folic acid you're taking may be doing no good or minimal good, potentially. Okay. So I think I just said this. People with MTHFR mutations most of the time can't convert this folic acid, which then causes it to build up. What it does when it builds up is it blocks folate receptors and interferes with folate activity. Okay. What the heck does that mean? What does that do? It basically further disturbs the methylation process. So go back to MTHFR, that's what methylation is. Needed for folate and other B vitamins like B12 from being able to do their jobs. And what did we say folate, B12, and other B vitamins are crucial for?
Energy.
nervous system and brain development, among many other things. Okay. So folic acid being given all the time, combined with someone maybe taking Tylenol, combined with someone maybe having an MTHFR gene mutation and not knowing it, you guys start to see the point here. There's all of these puzzle pieces that are starting to be put together that leads to potentially this perfect storm. Does X equal Y? Again, you can determine yourself, but these are just a few of the pieces of the puzzle that hopefully you're understanding how I don't think X equals Y. Okay, so what does that do? Again, folate's not, in its usable active form. It's going to lead further to oxidative stress, potentially DNA damage. And if you don't know, vitamin Bs are crucial for proper nervous system development. I already said that. And energy production too. Folate, okay, aka folinic acid is folate, okay, or you're going to see the, again, lucivorin, leucovorin, however you say that in the news because that's being put out there now. It's been around, but it's being put out there now. Have been shown to be somewhat effective even in treatment of some of these neurodevelopmental disorders like autism in improving communication, behavior, and language struggles. So they're actually using this. And again, I know the political thing the other day with the press conference, they talked about this, but it's been being used for a while. But it's not been, I don't think, something on the forefront of people's minds. But they've seen improvements even when kiddos or young people are struggling with some of these things. So that's pretty interesting, right? So folic acid versus folate. You need to know. You need to tell any pregnant woman that is in your life to be using folate, not folic acid. I've been telling people that, pregnant ladies, patients of mine, for years. We've known this for years. Okay. So why are doctors still saying folic acid? Guys, here's a tangent too. I might talk about this later. I can't remember if I put it in the slides. Any doctor is a human being. Okay. Number one, we're all humans. Okay. Do you guys know, like our medical system, one of the things that I feel like is most screwed up about it is how busy our physicians are. And I get it because I was in that trap for a long time. So busy. Like, are you kidding me? You want me to like go home at the end of my day and sit and read research all night and keep up on the evidence? Didn't happen back in the day when I was overwhelmed and overstressed and seeing too many people in a day. We're human beings. So a lot of times I feel, and I know because I talk to a lot of physician friends, is, they don't have time. They don't have time for this. So they may not even know some of this information. They may potentially just be recommending and prescribing based on what the governing bodies tell them. Okay. Is that an issue or is that not an issue? I'll let you determine the answer to that. Okay. So let's put it all together thus far. Tylenol during pregnancy has been linked directly in many studies, not all studies, but many studies, to increased risk of neurodevelopmental disorders. Fact. Many studies, many good quality, high quality studies. But what is not being talked about is the other science of everything I just explained. Okay. The genetics, the folate, the processes, the detoxification. So, Tylenol and how it affects glutathione, detox pathways, and especially in the developing brain and nervous system of babies is in the science that we know to be true. So, again, you don't even have to look at a study about Tylenol and autism. Okay. There's been those, yes, but you just need to look at the studies of what does Tylenol do in the body. That's what I'm trying to get the point of. And when you understand the science of what Tylenol and acetaminophen and any drug for that matter, what it does in the body, then you can start piecing together, okay, well, maybe it's causing this and then causing this, and then it's like a cascade effect, or again, developing into a perfect storm. So mixing in genetic predispositions like the MTHFR or GST, others and others. There's other genetic stuff too. This isn't a genetic talk. It can create the perfect storm in a mom or in a child. Okay. And these things potentially can have a negative effect. So the take home, this is not definitive proof. I don't, definitive proof, that's a very strong way to put it, that Tylenol causes autism. Again, how many times am I going to say it today? I think the latest research is we have to hear things 27 times before we actually hear them because we're all so distracted. Maybe it's 17 times. So I'm going to say it over and over. X does not always equal Y. Tylenol, does it cause autism or is it just one piece of the story? Okay. And if you guys, if anybody out there watching this wants resources or the peer-reviewed research articles that I basically, could go over everything I just talked about so far, just let me know. I didn't have time to put them all in the presentations today, but get a hold of me if you like to read data and read research. I'm happy to share those with you because it's all evidence-based. Okay. So let's use an example. So acetaminophen's effects on nutrient status extend far beyond its well-known acute liver toxicity. So that's one thing we do know that I talked about earlier is we know it can too much, too fast, too often can cause acute liver toxicity, liver failure, and it can kill you. Okay. And that creates a cascade of biochemical disruptions that affect multiple body systems through glutathione depletion. Okay, so glutathione and broader antioxidant network interference. Even therapeutic doses. Okay, so that's a key line. Therapeutic dose means like the recommended dose, like 400 milligrams, 600 milligrams, whatever, per every so many hours. Even therapeutic doses can cause significant nutrient depletion, particularly in vulnerable populations with implications for immune function, detoxification capacity, and long-term health outcomes. This is research. Okay, so these are the things we know. In susceptible individuals, how do we know if we're susceptible? That's a great question because I think everybody's brain automatically goes to like immunocompromised, maybe a NICU baby. I mean, there could be a million things, but susceptibility, I hope you guys are understanding where I'm going with this. Your eyes are more open. I'm more susceptible because I have an MTHFR gene mutation. I didn't find out until I was 35 years old. Okay. Does that make sense? I hope that makes sense. So susceptibility can mean a lot of different things. The depletion of glutathione and other antioxidants in a newborn, a toddler, or small children creates a vicious cycle where each acetaminophen dose depletes the very nutrient needed for safe metabolism of the acetaminophen, and subsequent doses, and it can start to accumulate and have accumulation effects. Okay. So hopefully that all makes sense for you guys. Okay, so next, let me just go over and present. What time is it? Oh my goodness, it's already 1:04. So here we go. Present some of the research showing. I'm probably going to fly through these because these are, okay, some of the actual studies that are out there that have been around, some of them for a long time. Some of them are pretty new. Between specifically, we're going to start with acetaminophen use in neurodevelopmental disorders and other chronic illnesses. I'm actually going to present to you some of the contrary evidence in a minute. So again, trying to see both sides of the picture here and show you some things that you might need to pay attention to. This study was just done in August of 2025 from a peer review. Again, you can see all these are PubMed, peer-reviewed studies. So acetaminophen, this was a meta-analysis. So what that means is they look at all of the studies that they can find on this topic, and they kind of weed them out based on their, the how good of a study they were, basically. And then they come to their conclusions. So acetaminophen is the most commonly used over-the-counter pain and fever medication taken during pregnancy, with greater than 50% of pregnant women using acetaminophen worldwide. Okay, so again, a lot of people are doing it, and can it be safe and effective? More than likely, yes, in certain ways. But again, starting to put all these pieces together. Numerous well-designed studies have indicated that pregnant mothers exposed to acetaminophen have children diagnosed with NDDs, including autism, ADHD, and other chronic illnesses at higher rates. Okay, so that was the conclusion of this. So the results here, this is kind of the results page of that study. They identified 46 different studies. 27 of the 46 reported positive associations. 9 showed no significant link, and 4 showed indicated negative associations. Higher quality studies were more likely to show positive associations. Okay, so again, the percentages, you can do the math. 27 of 46, okay, showed positive, statistically significant associations. And that's a key point. If you don't know research, things have to be statistically significant. It can't be like, oh, a few more were associated. It's statistical significance. So the conclusion of these authors were our analysis using the navigation guide supported evidence consistent with an association between acetaminophen exposure during pregnancy and increased incidence of neurodevelopmental disorders. Okay, so they advise that we look into this even more. Okay. While this association warrants caution, untreated maternal fever and pain pose risks as well. So I'm going to summarize this. Like this is the thing we always have to know, like risks and rewards. If a mom has and a pregnant mom has a fever that's out of control, okay, that has negative effects for that baby too. Okay. So this is neural tube defects, premature birth. I mean, so many things that we don't want to have happen. Okay. So again, the recommendation though is a judicious use of acetaminophen, lowest effective dose, the shortest duration, and of course under medical guidance, in tailored to individual risk benefit assessments rather than a broad limitation. So everything that I've basically said so far, there's so many pieces to the puzzle. What's not being done, in my opinion, is the judicious use of it. It's just kind of like it's safe and effective. Use it as you want. That's what I've heard. So I'm not just saying that. It's not biased. That is what I've heard. That is what people told me they've been recommended over years and years and years. Okay. So let's think about that and be careful of that. I wanted to include this because a lot of people who look at research, they don't look at this. This is at the end of every journal research article, you're going to have this section that says conflict of interest statement. Okay. So Dr. Baccarelli, if that's how you say it, first point is the fourth listed doc on this on the all the doctors that took place in this study that we just went over. Okay, so that means they weren't the lead author, but this doctor said that they served as an expert witness for a plaintiff's legal team on matters of general causation involving acetaminophen use during pregnancy and its potential links to neurodevelopmental disorders. So this doctor said that they were a part of this as an expert witness, but really is that a conflict of interest? But basically, it's showing that they're trying to put everything out there. Dr. Baccarelli has made every effort to ensure that this current work, like the past work as an expert witness on this matter, was conducted with the highest standards of scientific integrity and objectivity. Okay, so conflict of interest kind of seems to me like not a big deal. Okay, you're going to see my point in a minute. Okay, next study is another systematic review that was done in 2022, trying to seeing if there was a link between acetaminophen and autism. Okay, so recent studies have found an association between acetaminophen and immune system alterations like asthma and adverse neurodevelopmental outcomes. So again, these authors are seeing more than just NDDs. They're seeing immune system issues, asthma, things like that. The screened articles were checked. I'm not going to read all this. Okay. So again, I'm going to try to speed it up a little bit, but you can screenshot this. You can look at it, but there was 30 studies, 14 were thrown out because they were crappy studies basically. So they ended up having 16 high quality papers that they pulled all this. And in the red, you see all studies showed an association between acetaminophen use and listed neurodevelopmental outcomes. Okay. Long term use. This is the part that I don't want you to ignore because a lot of people will read that and they'll be like, see, told you. But here's the deal long term use, increased dosages, and frequency of how often were associated with stronger associations. Okay. So again, there's more to the picture than just X equals Y, right? The problem is we don't necessarily know how long-term abuse, what the dosage should be or shouldn't be, how frequent it's safe to use these things. My point with all of this is risk reward. If we don't know the dosage, if we don't know how long we can take it safely before affecting our baby or ourselves, weigh the risks. If you spike a fever of 104, do you need to take a little Tylenol? I'll leave that to you and your physician. because again, there are effects, negative effects of high fevers on an unborn child. Okay. But, again, I'm going to just say it because my experience, I couldn't tell you how many thousands of people over the years I've treated with headaches. Headaches are common, migraines, all the things. If you're popping Tylenol every day because you struggle with tension headaches or migraines, I just think twice. Just think about that. Okay. Find other alternatives because there are other things. There's natural remedies that have been shown to be just as effective as Tylenol. There's acupuncture, there's chiropractic, there's physical therapy, there's massage therapy. There's so many things out there that can help you. Okay. Here's the conflict of interest statement for that article. The authors have declared that no competing interest exists. Okay, good. Now on to the contrary evidence. So I told you I was going to show you again contrary evidence as well. So this study, acetaminophen use during pregnancy in children's risk of autism, ADHD, and intellectual disability. The conclusion and relevance here was acetaminophen use during pregnancy was not associated with children's risk of autism, ADHD, or intellectual disability in sibling control analysis. Blah, 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 familial co-founding. Now, here is, again, I'm not being biased here. I'm just pointing out the facts of the matter. Okay, so acetaminophen was not associated with risks of any of these things, but what does familial confounding mean? Okay, in research, confounding describes the effect of a third extraneous variable or confounder that influences both the independent and dependent variables, distorting the observed relationship between them. What does that mean? Is they, in this study, took the genetic issues away. Okay, they basically were ignoring the genetic thing. So if they had kids that ended up with autism, ADHD, but they're genetically predisposed, they took them out. Okay. So with everything that we learned at the beginning, with how important some of the genetics are into just how the science of our bodies work, that seems like to me not a great study and way to look at it. My opinion on that one, I guess. In 2024, this JAMA study, investigators found that when using sibling control analysis to account for genetic confounding, all associations disappeared. Okay, so think again with what I just said. So the associations between acetaminophen use and these neurodevelopmental disorders went away when they took out the genetic issues. Okay, so again, are genetics the cause? You can decide for yourself. I personally don't think so. I think it's a big potential piece to the puzzle. Big piece to the puzzle. Now, the conflict of interest statement for that big study that showed acetaminophen does not cause neurodevelopmental disorders. I'm just going to let you look at it. Multiple doctors. Okay, so, Dr. Johansson, Dr. Gardner, Dr. Lee, so three or four of the authors of this study admitted, because they have to ethically and legally, to being paid by different associations, receiving grants from different institutions like the NIH, from Department of Health and Human Services, the Defense Department, even, et cetera, et cetera, et cetera. So you can determine, is there a conflict of interest potentially? I mean, maybe those were all legitimate, funding sources and blah, 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 but I think we all can kind of know what potentially could be the issue there. Okay, so conflict of interest statements are always worth looking at and taking into account. Then you can go down a lot of rabbit holes, I'll tell you that, which I'm not going to do today. I have in the past, but I'm not today. So, moving on. What else could be going on? Genetic factors, okay? Epigenetics, which I haven't really talked about a whole lot, but epigenetics is the study and the science of environmental and lifestyle factors. Okay, so like I said, food, water, hygiene products, chemicals, chemical exposure, toxicities in our air we breathe, all the things. That's epigenetics. Epigenetics have a huge role in genetics and whether our genetic code is expressed or suppressed. Okay, so your lifestyle and how you live matters. Vaccines, question mark. Improper diagnosis of things, or maybe a better diagnostic way today. Is that help contributing? Stress and or trauma, preconception or in pregnancy. So it's another huge topic that I'm not going to go into today a whole lot, but stress in a mom and a dad. I'm gonna because this is true too, is like if a dad is stressed out, that stress is going to be portrayed into the partner, who then is, if they're pregnant, going to be portrayed or passed into the infant and the baby in utero. And stress can do some pretty crazy things. We call it the silent killer for a reason. In my world, call it the silent killer. And whether that's other traumas, PTSD, all these things impact the mom's nervous system, which impacts directly the unborn baby's nervous system. So this is a huge area that I don't think gets enough attention. Okay, stress and trauma, preconception or during pregnancy can drastically affect the nervous system health of a baby and thus the immune system, by the way. Okay, because you can't have a high functioning immune system and be stressed out. How many of you guys have been stressed out and that's when you get sick? I bet a lot of hands can go up there, right? You're stressed out, your immune system function starts depleting, starts going downhill, and then you end up sick. Okay. Birth traumas, another huge topic that I could talk about for hours. But we do know, at least I know, the evidence is out there that shows birth traumas not only are very common, more common than what you would think of. A lot of us probably think of like, oh, the baby came out with a broken collarbone or, whatever it is, like things like that. Birth trauma is so common and it's often undiagnosed. There's been studies that have shown that high majority of babies are brought into this world with trauma to their either occiput, their head, their skull, or their upper cervical spine. The reason that can become such an issue is where does all of the communication between our brain and our body go? Right through the upper cervical spine, the brain stem. So birth traumas, okay, more like the things that you're probably going to be able to relate to would be if a baby gets stuck, if they're cord wrapped, if they have to use a vacuum, if they have to use forceps. Again, those things might have to be done, but we need to have our little ones checked out and treated appropriately and not miss this stuff because that can set them up for nervous system dysregulation. Okay, and a stressful birth is a type of trauma, okay, that can affect the nervous system of a baby. So the answer here is yes, genetic factors can be at play. Yes, epigenetics can be at play. Yes, I think vaccines is a huge topic, guys. But vaccines, whether you're pro or anti, doesn't matter. That's not my point. They are a foreign object. There are chemicals in them. There are things that they do create a hyperimmune response. They do create a little bit of an inflammatory response. Your liver does have to process and detoxify from a vaccine. Like these are known things. No one's going to argue that stuff. Okay. So again, adding that into the equation, another puzzle piece that potentially could be contributing. Improper diagnosis, sure. I'm sure diagnostics have gotten a lot better over the years. There's no question of that. Stress, trauma, yes. Birth trauma, yes. Okay, so the answer to all of these is yes. All of these can be pieces to the puzzle. If you talk to parents, and I've had hundreds over my career, you're going to hear so many different stories, so many different thoughts, so many different opinions, so many different convictions from people. Because here's the deal: X doesn't always equal Y. Why are 10 kids who maybe are NDD diagnosed and they're all 10 different stories? Okay. Because not all the pieces of the puzzle are the same. All right. So that is kind of my takeaway tonight. We need to start looking at these things at a deeper root cause level. And again, I'm not selling stuff today, but like you guys that are on the call, but I'm gonna post this and send this to a lot of other people. Functional medicine is what root cause medicine is. Like we're going to look at the liver function. We're going to look at genetics potentially. Sometimes we don't run that on everybody, but a lot of times we look at genetics. We look at lifestyle. We look at epigenetics. We look at all this stuff to try to help you be as healthy as possible, thus your babies, your kids, your grandkids, everybody from there out. So I don't really think anybody's right. I don't think anybody's wrong. I think we need to agree, my opinion, that there may not be one right answer to this huge polarizing topic, right? So, a couple again, I fly through these. There's been studies that have looked a little bit at dose response relationships with acetaminophen. That I think just more evidence needs to be put out there on this. But the point of this article, what they have looked at, this dates back to 1987. They looked at therapeutic doses, zero point 0.5 to 1 gram of acetaminophen caused 5 to 10% of liver glutathione depletion within 12 to 24 hours, or sorry, with a 12 to 24-hour recovery time. So chronic therapeutic dosing. So if someone's using 1 gram every 6 hours, every 8 hours, multiple days in a row, that's going to establish a steady state liver glutathione reduction up to 70% of normal levels. Okay, that's a huge depletion of this potent antioxidant that we have to have to detoxify all this stuff. Okay, then this didn't even, of course, this doesn't even talk about it because it's not looking specifically at autism. So the reason I put this study up there is this is just looking at glutathione and acetaminophen. Okay, but then you start throwing in the genetic factor, the MTHFR, et cetera, et cetera. This exponentially increases even more how it's affecting us. Okay, another biochemistry of acetaminophen hepatotoxicity. Just another study if you like to read stuff. There it is. You can take a screenshot. Okay, children, this research article basically looked at because children present a complex risk profile. Highlighted there, it says emerging evidence suggests particular vulnerability to neurodevelopmental effects during critical growth periods. Acetaminophen crosses the blood-brain barrier and depletes brain glutathione by 14 to 24% in specific regions of now. So the point here is whether a baby's in utero, okay, the acetaminophen can get into the baby via the maternal blood, via the umbilical cord, and then it can cross the baby's blood-brain barrier. If you give a child acetaminophen, it can cross the blood-brain barrier. We know this. We know this. Okay. So what's the point? Okay. That child in utero or until they're how many years old are still developing. Their little brains, their little nervous systems are still developing. So if we're introducing these toxicities into them, what's going to happen? What potentially could happen? Okay, that's the question. Come to your own conclusion. Just the evidence. This was from 1993. Okay, journal article. Acetaminophen decreases intracellular glutathione levels and basically creates inflammatory responses, blah, 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 blah. Just another article for you to look at from 2005, International Journal of Biochemical Cellular Biology. I mean, who doesn't want to read about this stuff? Gosh, I don't know. Why are you guys, people probably rolling their eyes at me right now? All right. Here, I threw this in here because this is a bigger subject than just autism. Okay, this study that I just put up there, and then this is the abstract, looked at acetaminophen use with asthma. Okay, and again, it looked at glutathione levels and how important that was, and acetaminophen and how it increases the risk factors of asthma morbidity. Okay, so how many of our, and again, guys, this, I should have said this at the very beginning. None of the point of this is to like shame and guilt anybody. Oh my gosh, like how are you supposed to know all of this? I didn't even know all of this until I started diving in and spending the hours and hours at night researching this stuff. So, like, there's no shame, there's no guilt. It's like the last thing we need is for parents, moms and dads to be like, oh, shoot, we gave our kid a bunch of Tylenol and they have asthma now. Oh, we shouldn't have done that. But point is, okay, there's a lot of things you can do to help them still when they're in the midst of things like asthma, ADHD, neurodegenerative disorders, whatever it is. But to pass the information along. So, like I said at the very beginning, pass this along. Get people to watch this talk, other talks. There's people out there a lot smarter than me that are talking on this subject. So, of course, I'm just doing the best I can. But people need to hear this stuff for the sake of our children, for our children's children, our children's children's children. How many children have I said now? Generations to come. Okay. Again, mechanisms through oxidative stress and glutathione depletion can lead to a lot of issues. Okay. We've talked about this. The perfect storm develops, the immune system changes, the nervous system changes, all of these things. Okay, so I guess let me read this. So, for example, would it be logical? I should have posed it as a question. Would it be logical to come to a conclusion that it's possible that a young child who is still developing, who is administered a vaccine with a lot of ingredients, and then concurrently or afterward is given acetaminophen because they now have pain from the even just from the needle poke. We all know injections,
Yeah.
vaccines hurt. Okay, so if they're given acetaminophen for pain, or maybe they spike a fever, very common after a vaccination because your immune system's put on heightened alert, and a lot of people develop fevers. Okay, this is very common to have this done, acetaminophen after vaccination. Could that be creating an environment in which the perfect storm starts to develop? Okay, so now what we know about acetaminophen and what it does, it lowers our defenses. Okay, it enables more toxic things to be going on, specifically in our liver and our brain and our nervous system. And then we're introducing, or we just introduced a different vaccine. Pick your vaccine. I don't care what vaccine you're going to talk about. Okay, could that be part of the issue? It's a question. It's a question mark. But even if that's true, if you said yes, well, that makes sense. Does that mean causation? Again, does X equal Y, or are there more things to uncover? We must understand the complexities of all of this stuff. Okay. I don't think it's either or one thing causing one thing. Like I said a million times, has that been 17 yet? I hope so. One thing doesn't necessarily cause one thing. It's about exposing the entire toxic system of our environment, our products, our food, our water, medications, vaccinations, along with genetics. Potentially that can increase risk factors for kiddos. And probably one of the reasons that our kids now are the sickest generation to ever live on the earth, especially in our country, which is sad because we have the best medical system. How does that make sense? I don't know. No one's ever going to convince me that that makes any sense. But moving on, there aren't a lot of studies that, to my knowledge anyway, where they control for acetaminophen use with vaccinations as a confounder, like we talked about earlier. But there have been a little bit of that, and I'm going to show you in a second. It matters quite a bit. So this would be kind of a logical thing, but it's tough to do in research sometimes. But this study, 2008, in the Autism Journal, okay, acetaminophen use, measles, mumps, rubella, so the MMR vaccination and autistic disorder, the results of a survey. So they did a survey, a parent survey, again, not probably the best type of research out there. I know somebody's going to knock it, but it is valid, right? There's different types of research. There's double-blind placebos, trials, blah, 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 blah. There's all these different things. But this was a parent survey of what happened to their kiddo. The present study was performed to determine whether acetaminophen use after the measles, mumps, rubella vaccination could be associated with autistic disorder. Specifically, acetaminophen use after measles, mumps, rubella vaccination was significantly associated with autistic disorder when considering children 5 years of age or less. Okay. Ibuprofen use after MMR vaccination was not associated with autistic disorder. This preliminary study found that acetaminophen use after MMR vaccination was associated with autistic disorder. Okay, more research needed, of course, is probably another thing they said, but let's just take it for what it is. Okay, acetaminophen use after again, what I just explained, how that process would look. You give a vaccination, okay, which is a hyperimmune response in the child. Maybe they spiked a fever, maybe they had a sore arm, maybe they had a headache, whatever. So then they're given acetaminophen, very common, like I said, and that was shown in this survey study to be hugely associated with developing autistic disorder. Okay, something to think about. And the results actually showed it wasn't even just like a two times, it was a 6 to 8 times greater occurrence. 6 to 8 times greater occurrence than someone who was not given acetaminophen after the MMR vaccination. Okay, so X does not always equal Y. Some other arguments I've seen are Tylenol can't be the cause because it was widely used as early as the 1950s. Has anybody seen all these arguments that people are putting out there? And so it can't be why we saw this autism spike and other neurodevelopmental disorders. Yeah, I would say, yeah, that's true. Tylenol was in wide use in the 50s and 60s, and we didn't see the neurodegenerative or these neurological issues until more like the 80s and 90s. Okay. Tylenol was still obviously being used, maybe more, maybe not. It's hard to know. But paired with the increase in the vaccine schedule, in which it tripled. This is the question. The spike of neurodevelopmental disorders came in the 80s and 90s when Tylenol was still being used, just like it was in the 50s and 60s. What changed? So I said that pretty confusing earlier. What changed from the 50s to the 80s? The vaccination schedule tripled.
Yeah.
Okay, here's the chart. The number of doses, and on the x-axis, the bottom is the year. So again, it goes all the way back to the 1970, and you can see the number of doses given, and then the autism prevalence. Again, is this causation or correlation? Somebody's going to make that argument. Oh, that's just coincidence. Is it? Make that argument. Debate somebody who knows what they're talking about. Okay. But this is definitely a very interesting correlation. Okay. And especially when you pair it with all of the science and evidence that we just talked about for the last however many minutes. What the heck does this mean? Okay, we can draw the following conclusions and questions based on a lot of evidence, much evidence. So to wrap it all up here, acetaminophen use during pregnancy and in children has been linked to neurodevelopmental disorders of many kinds, but the question remains, is it due to that alone or a paired response with vaccination, as Tylenol is known to weaken the immune system while vaccination is creating a hyperimmune response? That's one argument. Second argument would be disrupted glutathione plus liver detox pathway issues, which we covered at the beginning. That leads to cellular toxicity, an altered immune function response, and an altered nervous system function response. And number three, altered immune signaling in the developing brain has been seen in study after study after study, which again may lead to a more susceptible situation when too many insults are paired together. Okay, so that perfect storm. Too many things all at once or accumulating over time could be the issue here. Number four, we know, of course, that I don't think even, someone who's like the most pro-vaxxer researcher ever wouldn't argue this. Vaccinations create a hyperimmune response. Okay. And in susceptible individuals, it may create the perfect storm of toxicity in which, and that was all explained above. I mean, that's not, you can't even hardly argue that. Okay. And then you pair it with wrong treatments. Okay, so what I mean by that is like maybe they're like, oh man, that kid got sick after the vaccine. Let's give him some Tylenol. Okay, you pair that. Maybe it's a different drug. Maybe it's a different medications. Maybe it's the lifestyle. Maybe they were already susceptible because the mom, had some sort of trauma during pregnancy. We talked about the nervous system of a little baby. Maybe, who knows? We could go on and on and on. Okay, you guys get the point. Pieces to the puzzle that make every story different in this world. The primary question in my mind, at least, comes down to risk and reward, like I said earlier. Is the risk of using interventions like this that are highly debated as being safe and effective worth the risk to you? And again, that's for you to determine with your child and your health. Okay. But I hope, I just hope that with the evidence I've laid out today, hopefully it made sense and hopefully it will make you think deeper about this. And again, try to take a step back from the polarization, the political mess. Like just look at evidence, just look at the science, and then determine if the risk and reward are worth it. Or can you go get a different treatment for your headaches? Okay, think about it. To some, the answer would be yes. To others, it would be no, and that's fine. It's called health freedom, right? Informed consent and all of those things. That's just your right and your choice in the amazing country that we live, the freedom to decide in many instances. And unfortunately, some of those freedoms are trying to be taken away from some people who believe a certain way. But again, another topic for another day. To end, we must keep in mind that there is still much debate in this subject, and I think there's always more evidence and more research that needs to be done. But what is truly safe and effective? Again, maybe some of you can think back the last 5 years or so, and it's like, man, well, shoot, that maybe they're not always right. Go back even further. What years was it? Was it in the 50s where they said smoking was fine for a pregnant mom? I could be making that up, but I mean, just science changes over time is the point. Like what we think or know today may not actually be true. Okay, so always question, always dive in. Okay, here's the deal. It is 1:36. Thanks for hanging out and anybody who's watching, it's been an hour. So I'm gonna do this. The vaccination topic is huge. And there's so much conflicting evidence. I'm not diving into that really a lot today. But what many don't know or have been like not privy to is what actually has been done, what's not been done, and or covered up to some degree. Again, I think that's not me being biased. That's like a fact at this point. And so I'm going to give you guys one thing about that and then kind of be done for the day. Um, I think I already said all that. We're all human. This is what I said earlier. Doctors are humans. We don't have all the time in the world to like research all this stuff. So that's one thing. But here's what I wanted to leave you with in regards to vaccinations. Um, One of the things that has been said by many people over the years, including someone like RFK Jr., is that there's never been studies in vaccinated versus unvaccinated control groups. And that's a major issue. Like, why would you not want to look at that data, right? Well, so I'm sure a lot of you guys have heard this because that was the big deal for a lot of years. And apparently, it has now been uncovered that there was a study done. Yep. And it wasn't done by any anti-vax group. It was done at the Henry Ford Medical Center. The lead researcher was the head of the infectious disease department. And he specifically was a heavy pro-vax doctor who started the study. He literally says it in the study. The purpose of this study is to dispel the myths that vaccinations are an unhealthy thing or that cause XYZ. That was the point of the study. Okay. Has anybody ever heard of this study? The reason nobody heard this study, it was drawered. Okay. It was not published, it was hidden because what they found was not what they were expecting or wanted to find. 18,000 unvaccinated and vaccinated kids from, so that's a huge study. The point of that is it's a huge study. And it was from the years 2000 to 2016 based on the medical records of these kids from birth onward at the Henry Ford Medical Center. Okay, so they were all 16 years old, basically, the first 16 years of their life. What did it find? 4.29 higher rates of asthma in which group? The vaccinated group. All of these are going to be higher in the vaccinated group. 5.96 higher rates of autoimmune disease, 5.3 higher rates of neurodevelopmental disorders such as autism, but not only autism. 3.30 higher rates of atopic diseases, 3.28 higher rates of developmental delay, 4.47 higher rates of speech disorders. And then they also did not have the statistics like this, but ADHD, tics, learning disabilities, etc. For example, with ADHD, there was 262 ADHD cases in the vaccinated and zero in the unvaccinated. And that was basically the summary was there was zero of everything in the unvaccinated group. Okay. By age 10, 57% of the vaccinated group had chronic illness, at least one or more. By age 10, only 17%. So again, it's not like, vaccine, we're not, 17% of unvaccinated kids had a chronic illness. It can, again, X doesn't always equal Y, but the statistic here is astounding, the difference. 57% had a chronic illness, one or more, compared to 17%. So again, I don't know if you guys have heard of this yet. Again, it was just a number of weeks ago that at the Senate, in the Senate hearings that are going on right now, this was presented. by a very smart guy. He's actually an attorney. If anybody's not been watching some of that, man, you should watch it. I don't know if this is going to work. I just wanted to show you this. If anybody needs to go, great, no problem. Oh, you know what? I'm going to do this a different way. Kristen, I can see you. Can you give me a thumbs up if you can hear this in a second?
I was saying one of the 72 vaccines mandated for.
Okay, so here's the deal, guys. This is the last thing today. The most important part of this video is probably the first 5 to 7 minutes. It's 14 minutes long, I think, and yeah, 14 minutes and 11 seconds. If you want to watch this whole thing, great. I'm going to let this play. You might even see me step off camera for a minute. And then once this is over, that is going to be the conclusion of this talk. So this is worth listening to if you haven't seen it. It's not all RFK. This is going to cut to the Senate hearings that just took place. And this has to do with vaccinations. So worth listening to. And all I want to say to anybody watching this, again, number one, you can email me, you can DM me on socials, any questions. Again, I understand this is polarizing. Not everyone's going to agree with everything I presented today, and that's fine. Just, we don't need to spread hate is all I'm asking. And then also for those of you who are interested in what I presented today, you have questions, of course, ask me questions. If you want to set up a call, I do free complimentary calls. You can get that link on my socials on my website to do that. And then if you're interested in functional medicine for you and your family, man, that's the way to go. It's the way to go. So just reach out to me. With that, everybody, I'm going to tell everybody that's on the call here, have an awesome day. Man, you guys stuck around. You must have been interested by this in some way. So thank you for coming. Listen to this video. And if you don't have time now, you guys that are on the call, let me know and I can send you the link to this video, but it's on Facebook, it's all over the internet. So with all that, good day, everybody. I'll play this for you guys.
I was saying one of the 72 vaccines mandated for children has ever been safety tested in relicensing placebo-controlled trials, not one.
Chairman Johnson, Ranking Member Blumenthal, and members of the subcommittee, thank you sincerely for the opportunity to testify. It is a true privilege to be here. My name is Jake Scott, and I'm an infectious diseases physician at Stanford. I've spent my career treating patients and evaluating medical evidence with a focus on vaccine safety and efficacy. I have no financial conflicts of interest. My vaccine research is either self-funded or supported by Stanford University. Since April, I've co-led an international team building what we believe is the most comprehensive database of vaccine trials ever assembled. We set out to answer a fundamental question. What does the complete trial record actually show about vaccine testing? We've cataloged 1,088 randomized controlled trials.
We lost audio.
Our findings directly refute false claims about vaccine testing. We documented 661.
I'm just going to rewind a little bit because when I muted my camera, apparently,
accessible.
so that should be good.
Anyone with internet access can verify our findings. This is what transparency looks like. Our findings directly refute false claims about vaccine testing. We documented 661 trials using inert placebo controls.
Okay, so everybody's clear on this.
Good.
This
I'm
guy,
so
Dr.
sorry.
Jason,
You're okay. I can't get out of it.
trying to tell them what they've done as far as the study they're putting together that shows there's no issues with vaccinations, basically, is what he's saying right now. You need to pay attention to what's coming though, because you're going to have two experts. One's the attorney and one is actually a PhD researcher. You need to hear what they have to say because it is eye-opening.
We documented 661 trials using placebo controls.
Mr. Sear, I'd like you to go to your section and talk about the 661 studies that Dr. Scott is talking about in terms of these inert placebo controls.
567 of these trials were not a routine injected vaccine for a disease on the CDC's childhood schedule. They were for HIV vaccines or other vaccines. So totally irrelevant.
Did you catch that? What Dr. Scott is trying to say is they have 661 studies, okay, showing the safety and effectiveness, but 567 of these were not even with the childhood schedule. That's an issue, okay? Logically, he'll keep going. Shoot, it keeps doing that.
Meaning
There
94
we go.
studies, 70 of them did not involve healthy children. For example, trials of HIV positive adults. Again, completely irrelevant to the safety of childhood vaccines. Of the remaining 24, 21 did not involve a US licensed vaccine. It was not a vaccine used as a control to license a currently used US licensed vaccine. For example, Chinese flu shots, stuff like that. That leaves us with 3 studies. 3. Okay, let me walk through those 3. One was a trial for the chickenpox vaccine, the varicella vaccine. Now that trial had it was only a few hundred people, so it was underpowered anyway. But Dr. Scott says it's got an inert control, but actually it was an injection of neomycin, an antibiotic. That's not inert.
No.
And neomycin used topically can cause issues, let alone injected. The second one was Gardasil 4 trial, which had thousands and thousands of girls and women in the control group. Almost all of them got an aluminum adjuvant injection. And then there were a few hundred, only a few hundred, that were labeled as a inert control, but they weren't. They got everything that's in the vial except for the antigens in the alum, which included L-histidine, sorbate 80, sodium borate, yeast protein, not inert. And then the third one was a Gardasil 9 trial, which finally, by the way, did have a saline injection, just a few hundred. There were thousands and thousands of girls, women in that trial. They all got an injection of aluminum adjuvant, which I don't even know if it's ethical to inject somebody with something that's neuro and cytotoxic. But leaving that aside, the few hundred that got the placebo, but they only got it if they first got 3 doses of Gardasil 4. So again, not an actual inert control group. The result is there's 0 trials, 0, which were relied upon in this list of 6061 to license a routine injected vaccine on the CDC schedule that included a placebo, as well as 0 trials of a vaccine used as a control to license a routine injected vaccine on the CDC schedule.
And the whole point of developing or doing this list, this crowdsourcing or whatever, leading an internet effort for the 661 studies was all to prove Secretary Kennedy wrong when he said that there's never been any of the vaccines on childhood schedule that have had a true placebo-controlled, random-controlled trial. And you've just gone through the 661, and that statement's true. Dr. Scott, go ahead and, I guess try and refute that.
So, yeah, the reason why we did this project was to, yes, directly address through systematic evidence compilation the questions around the quantity and quality of clinical data supporting vaccine safety and efficacy. We found 1,000, we screened thousands. We've extracted data from 1,088 randomized controlled vaccine trials. We started our search in 1800, and studies were published from 1941 until 2025. Of those 1,088 studies that are randomized controlled trials, 661 used what we consider an inert placebo, generally saline, etc. There were a number of other control groups used historically for various reasons, partly for ethical considerations and partly just because things have developed over time. As far as this being an example of how there aren't enough data to support the safety and efficacy of vaccines. I don't see the logic there.
Well, I think Mr. Siri completely picked your 661 studies apart. You said, saline, et cetera. I think it's wondering what's the et cetera. Mr. Rogers, you kind of raised your hand. You want to speak to that?
Yes, ma'am, please. Thank you, Senator Johnson. So look, in PhD programs, you have to read original sources and you have to define terms. Let's be crystal clear about the definitions of these terms, because the fate of the Republic depends on getting these definitions right. And Dr. Scott is playing fast and loose with these definitions. So let's be crystal clear about what we mean. Inert should mean that the substance does not cause a chemical or biological reaction in the body. When supporters of the status quo use the word inert, they can mean just about anything. Paul Offit routinely calls mercury and aluminum inert, even though they are known neurotoxicants. Philip Grandjean and Philip Langergan they're the best two toxicologists in the world. They published a study in 2014 that says both aluminum and ethyl mercury are known neurotoxicants. But the supporters of the status quo say that these things are safe, and they're not. They're absolutely not. In the context of vaccines, placebo should mean saline, as verified by independent third-party testing. That's not what the supporters of the status quo mean when they say placebo. The fact is the FDA has no regulations concerning the contents of placebos. So manufacturers can put whatever they want into the comparator intervention and can still call it a placebo by law. Furthermore, scientific journals have no regulations concerning the contents of placebos. Sometimes the manufacturers disclose them in connection with the study, and about 2/3 of the time they do not. And a double-blind randomized control trial should have two groups. A group that receives the vaccine, that's the treatment group, and a completely unvaccinated group. Given a saline placebo, that's the control group. That's not what the supporters of the status quo mean when they say randomized control trial. They compared two groups, but one group gets the new vaccine and another group gets a shot full of aluminum adjuvants. Or they compare a new shot to an older shot. But the one thing they never do is to compare a completely unvaccinated group with a vaccinated group, because everyone knows that such a trial would show harms. So if you go through all 1,704 trials in the database that Dr. Scott has put together, as Aaron Siri has done, you will find that the inert ingredients are not inert. The placebo is not saline, and the randomized control trial does not have a completely unvaccinated control group. And we know that my assertion here is correct because on page 9 of his written statement, Dr. Scott states that vaccinated versus unvaccinated studies are especially prone to bias. It's hard to imagine a more Orwellian statement. Up is down, left is right, dogs are cats. And according to Dr. Scott, a proper vaccinated versus unvaccinated study is unethical. That's why we're in this mess. That's why we have an autism and chronic disease epidemic in this country.
Scott, first after Scott respond to that.
Yeah. Yeah, I'd be very surprised if you went through all 661 trials. We haven't even conducted the full analysis yet. But once
I think
once
series,
yeah,
so series kind of has.
you should join our team. Yeah.
He's got a pretty crack team doing that.
Yeah,
if you let me make the decisions, I'll join your team.
Let's do it. Let's team up. So yeah, first of all, yeah, we are, this is a work in progress. Hopefully it'll be published. And once it's published, I welcome any feedback for sure. In terms of how we defined controls, that has not been publicized yet because we haven't published this, okay? But we did break it down between inert placebos that were biologically inert and placebos that were immunologically inert. So biologically inert placebos primarily include saline or buffer or water. And so there are certainly many studies that met that criteria. Then there are adjuvant-only controls. So we separated all that.
But again, the whole point of the 661 studies was to prove Secretary Kennedy wrong when he never said, and I don't know the exact statement, but there's never been any vaccines on a childhood schedule that have had a true random
I have the
control.
quote here if you'd like.
Yeah, go ahead.
Oh, sure. So Secretary Kennedy said, this was the CNN article reported, that, quote, 76 shots that children in this country receive, unquote, meaning routine injected vaccine on the CDC schedule, quote, none of them have been safety tested in pre-licensure studies against the placebo. In response to that, the CNN article quotes Dr. Scott as saying that that made Dr. Scott's ears perk up, end quote. Scott, an infectious disease specialist at Stanford University, knew that the assertions couldn't be true. And now he says he has the proof, meaning Dr. Scott, quote unquote, knew the assertion couldn't be true before he even looked and did it. So whatever he's planning to publish, obviously he had his a priori belief beforehand.
So I was familiar with the body of evidence. I wasn't aware that there were going to be 1,088.
So
well, then why not start with the clinical trials that are actually published by the FDA and relied upon to license each vaccine?
We've included those as well.
Again, the problem with this discussion debate is it just gets into a lot of detail, and you have accusations going back and forth and assertions made back and forth. It is very difficult to follow. Okay, again, I personally think that Mr. Sear did a pretty good job of taking that 661 studies apart.
For many years, I was saying not one of the 72 vaccines mandated for children has ever been safety tested in pre-licensing placebo-controlled trials. Not one. Tony Fauci was saying he's lying. In 2016, President Trump appointed me.
I don't know if any of you have ever heard him talk about this story, but if you've kind of dozed off, listen to this because this is also, I mean, it's just interesting.
And he ordered Fauci and Collins to meet with me with White House children has ever been safety tested in pre-licensing placebo-controlled trials. Not one. Tony Fauci was saying he's lying. In 2016, President Trump appointed me to run a vaccine safety commission. And he ordered Fauci and Collins to meet with me with White House counsel present. And I said to Fauci at that meeting, you say I'm lying. For 8 years, you've been saying I'm lying about this. Show me the study. And he said, I don't have it here. It's back in Bethesda. And I'll send it to you. I never got it. So I sued him. Me and Aaron Siri, and after stonewalling us for a year, their lawyers met us on the courthouse steps and said, yep, you're right. We never had any study. And they gave it to us in writing. You can go to the CHD website, my website, and you can see that letter from HHS.
So there you go. I thought it was an interesting debate, and that's all happening right now in our government. So it's interesting to say the least. Again, draw your own conclusions. I will say, I'm just going to add, what RFK has been arguing for, and many others. It's not just him, many other doctors for years now about the safety procedures and studies, which again, he's claiming they've never actually done, and he's been shown to be right in a lot of ways. But then I also just wonder, because I'm not an expert in this, I wonder, well, if it's true that no true great research has been done with the safety of these things in regards to the childhood schedule, then how in the world would we know? And that's one vaccine versus a control group. How in the world would we know then how multiple at the same time or multiple a couple months apart, how those are reacting with each other and then with the body? That's, I guess, a logical question in my brain. Like, oh my goodness, like um, something to think about. Anyway, so again, listen to all sides of the story. I try to listen to so someone like Dr. Scott, I listen to him. He's obviously a smart guy. He's obviously passionate about what he does. So I try to listen to all sides of the story. And again, I'm going to throw in my bias now because we're at the end of this and I probably have a few times. But I'd say, for me and my family and my kids, there's so many things. I don't need to go into the details, but there's so many things that weighing the risk and rewards we've decided to do or not to do. And I don't need to say the details. But we've chosen to do what we know is right. and what we believe as far as the evidence shows, and very evidence based. And I've said this many times before, so a lot of you guys will hear this for the 15th time. Some of you who've never listened to me before that are listening, I have 3 children. Again, God willing, knock on wood, whatever you want to do, that they will continue to be what I'm about to say. But our kids get sick. My kids get sick, but they kick it so quick. And I have an 11-year-old, an 8-year-old, and a 5-year-old. Okay, 11, 8, and 5. Not one single dose of Tylenol, no, not one antibiotic, not one anything have we ever had to use with our kids. Okay. So is it possible? Yes. Now, if that's not your story, if your kids have been on antibiotics, if your kids have used steroids, all the things, right? That's fine. Okay. You got to pick up the pieces somewhere. You can definitely affect their long-term health. But again, this is where functional medicine is. Okay. The reason my kids have been able to live that thriving, healthy life without the use of these things is through a functional medicine approach, right? Lifestyle medicine that both myself and their mother truly believe in. So, with that, guys, thanks for paying attention for so long. My goodness, that was a lot longer than I thought it was going to be, but what's new, right? So, it's 2:02. Have a great rest of your day, and I will hopefully chat with many of you in the future. So, thanks for coming. Thanks for listening.